Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. Today, we are going to discuss about surgery for fibroid, particularly when you are suffering from infertility. You have probably seen our last video where we have said that all types of fibroids do not need treatment. In fact, majority of the times the fibroids are not responsible for infertility. Therefore, if there is fibroid and if you are suffering from infertility, that does not mean that always you have to remove the fibroids, because there are some risks related to surgery of the fibroids. Therefore, we remove the fibroids if the fibroids are located on the inner side of the womb, that is called submucous fibroid, or some particular cases of intramural fibroid, that is when the fibroids are located in the wall of the womb and it's causing distortion of the lining of the womb. Of course, we have to remove the fibroids if you have any other problems like severe bleeding or severe pain. Otherwise, majority of the time fibroids are not responsible for infertility and that can be left without any treatment. Now, how we can treat the fibroids? No medicine can work if you have infertility and fibroids. The treatment is definitely surgery. But gone are those days when fibroids were removed with open operation, that is making a big cut in your tummy. We don't want to give a big cut because if we make a big cut, it will take time for you to recover. It will take time for you to come back to normal life and join your duty. We are doing the operation of the fibroids by endoscopy. If the fibroids are located purely on the inner side of the womb, that is if it's completely submucous fibroid, in that case, even you don't require any operation in your tummy. We can remove the fibroids by hysteroscopy, that is by inserting a camera through the vagina inside your womb, and we can take out the fibroids. But if the fibroids are intramural, that is located on the wall of the womb, or if it is big submucous fibroid that extends to the wall of the womb, in that case you require keyhole surgery, that is laparoscopy. That is, we have to make small opening in your tummy, and through this opening we insert some instruments, and with this instrument we take out the fibroids. But sometimes you may require both the treatment together, that is laparoscopy and hysteroscopy, that is making opening in the tummy and at the same time inserting hysteroscope through the vagina in the uterus. But remember, fibroid operation has some benefits. It can reduce your pain, it can reduce your bleeding, and it can sometimes improve the chance of pregnancy. But there are some risks. The most important risk is bleeding. Therefore, before operation, we have to ensure that your hemoglobin is normal. And during operation, there is chance of excessive bleeding. That's why we usually keep blood in hand, provided that you don't have any objection to blood transfusion. Many times we can tackle the bleeding by giving some injection, some medicines, or using some special stitches. But very rarely, bleeding cannot be controlled by these methods. In that case, we have to take the decision for hysterectomy to save your life, that is removal of the womb. Please don't get afraid when I am saying that you may require hysterectomy while removing the fibroid. You are suffering from infertility. Our aim is to remove the fibroid and keep the uterus. For example, when you are crossing the road, there is risk of accident, but that does not mean that always you will have accident. Similarly, when you are going for fibroid surgery, there is small risk of going for hysterectomy, that is removal of the womb. But the chance is extremely rare. If 100 women are undergoing removal of fibroid, one can have severe bleeding that require hysterectomy. Otherwise, we can safely remove the fibroid keeping the uterus. Sometimes the removal of the fibroids can cause infection just like other cases. And fibroids can even come back even after operation, but it can take some time for coming back of the fibroids. And remember, even after removal of the fibroids, sometimes you may not be able to conceive. That's why before doing operation, we have to make sure that your tubes are okay, your ovaries are okay, and your partner's sperms are okay. But remember, majority of the times fibroids do not require any treatment because most cases fibroids are not responsible for infertility. Thank you for watching this video. If you have any queries, please don't hesitate to contact us through our Facebook page or YouTube channel.